peaceful space. Let yourself settle in completely. Take a deep breath, filling your lungs fully, and then release it with a soft sigh. Allow any tension you're carrying to simply dissolve. Today we're going to explore the profound connection between your inner calm and your skin's inflammation, and how cultivating peace within can create peace on your skin. Inflammation is at the root of nearly every skin concern you might experience. Acne, redness, sensitivity, premature aging, rosacea, eczema. All of these involve inflammation at some level. While topical treatments have their place, there's a powerful truth that's often overlooked. Your emotional state directly influences inflammation throughout your body, including your skin. When you learn to stay calm, you literally reduce inflammation in your skin. This isn't mysticism or wishful thinking. This is biology. The connection between your mind and your skin is mediated by your nervous system, your immune system, and your hormones. These systems are in constant communication, and your emotional state is part of that conversation. Let's explore how this works and, more importantly, how you can use this knowledge to improve your skin. Let's begin by understanding what inflammation actually is and why it happens. Inflammation is your body's natural response to perceived threats, injury, infection, irritation, or stress. When your immune system detects a threat, it triggers an inflammatory response. Increased blood flow to the area, immune cells rushing to the scene, the release of inflammatory molecules called cytokines. In the short term, this is protective and healing. A cut on your skin becomes inflamed as your body works to prevent infection and repair the damage. This is acute inflammation, and it's beneficial. The problem arises with chronic inflammation, low-level, persistent inflammation that continues long after any real threat has passed. This chronic inflammation damages healthy tissues over time. In your skin, chronic inflammation breaks down collagen, impairs barrier function, triggers excessive oil production, creates sensitivity, and accelerates aging. It's the enemy of healthy skin. Here's where your emotional state enters the picture. When you're stressed, anxious, or emotionally agitated, your body perceives this as a threat. Your stress response activates, releasing cortisol and other stress hormones. These hormones trigger inflammatory pathways throughout your body. Your immune system shifts toward a pro-inflammatory state. This happens whether the stress is from a real physical danger or from worry about your to-do list. Your body responds to both with inflammation. Chronic stress means chronic inflammation. Day after day of elevated stress hormones keeps your entire system, including your skin, in an inflamed state. This manifests as reactive, sensitive skin that breaks out easily, heals slowly, and ages prematurely. Now consider the opposite state, calm. When you're genuinely calm, not suppressing emotions, but truly peaceful, your stress hormones decrease. Your parasympathetic nervous system activates. Anti-inflammatory processes engage. Your immune system shifts toward balance. Inflammatory markers in your blood decrease. This internal shift manifests externally in your skin as reduced redness, fewer breakouts, better healing, and improved overall health. Let's explore the specific ways that emotional agitation creates skin inflammation. First, stress hormones, particularly cortisol, directly increase inflammation. Cortisol triggers the release of pro-inflammatory cytokines. These molecules create and sustain inflammatory reactions throughout your body. In your skin, This inflammatory cascade can trigger or worsen conditions like acne, rosacea, psoriasis, and eczema. Second, stress disrupts your gut microbiome, and your gut health directly affects your skin. When you're stressed, your digestion suffers. Your gut becomes more permeable, allowing inflammatory molecules to enter your bloodstream. This systemic inflammation affects your entire body, including your skin. The gut-brain-skin axis is a real and powerful connection. Third, stress impairs your skin's barrier function. Your skin barrier is your first line of defense against irritants and allergens. When stress hormones weaken this barrier, your skin becomes more vulnerable to inflammatory triggers. Things that wouldn't normally bother your skin suddenly cause reactions. Fourth, stress affects your sleep, and poor sleep increases inflammation. During deep sleep, your body performs essential repair and regeneration, including reducing inflammation. When stress disrupts your sleep, you lose this crucial anti-inflammatory recovery period, and inflammation accumulates. Fifth, stress often leads to behaviors that increase skin inflammation, touching your face, picking at skin, neglecting your skincare routine, eating inflammatory foods for comfort, or overusing harsh products in an attempt to fix stress-induced breakouts. These behaviors compound the direct inflammatory effects of stress itself. Now let's explore how staying calm actively reduces inflammation and heals your skin. When you cultivate genuine calm through meditation, breathing practices, mindfulness, or any method that truly settles your nervous system, you activate powerful anti-inflammatory mechanisms. Your stress hormone levels decrease. Your body releases anti-inflammatory molecules. Your immune system rebalances. Blood flow improves, delivering healing nutrients to your skin while removing inflammatory waste products. Your sleep improves, allowing more complete repair and inflammation resolution. Your gut health often improves as stress-related digestive issues ease. Your skin's barrier function strengthens as stress hormones stop undermining it. You make better choices about skincare and lifestyle because you're operating from a place of clarity rather than anxiety. The visible effects can be remarkable. Redness decreases, reactive skin calms down, breakouts reduce in frequency and severity, healing accelerates. Your skin simply looks and feels healthier, often without changing any topical products. So how do you cultivate calm in a way that actually reduces inflammation rather than just suppressing stress temporarily? First, understand that true calm isn't the same as distraction or numbing. Scrolling social media, watching television, or having a drink might temporarily take your mind off stress, but they don't actually shift your nervous system into a calm state. In fact, some of these activities can increase agitation. True calm comes from practices that genuinely activate your parasympathetic nervous system and allow your body to release held tension. Meditation is one of the most powerful tools for reducing inflammation through calming the mind. You don't need elaborate techniques. Simply sitting quietly, focusing on your breath, and gently returning your attention to your breath whenever your mind wanders. This simple practice, done regularly, reduces stress hormones, lowers inflammatory markers in your blood, and creates a baseline of greater calm in your life. Start with just 5 or 10 minutes daily. Sit comfortably, close your eyes if that feels right, and breathe naturally while observing your breath. When thoughts arise, and they will, don't judge them or yourself. Simply notice and return your attention to breathing. This practice trains your nervous system to settle more easily, which over time means less chronic activation of inflammatory pathways. Mindfulness throughout your day extends meditation's benefits. Mindfulness simply means paying attention to present moment experience without judgment. When you're washing dishes, actually wash dishes. Feel the water. Notice the movements. Be fully present.
Treatments, typically 3 to 6, provide progressive improvement. Laser resurfacing works for all scar types but is most effective for shallow scars and ice pick scars. Dermal fillers inject material beneath scars to fill depressions temporarily. Different fillers last varying lengths. Some last 6 months, others 1 to 2 years. This approach works well for ice pick and boxcar scars but requires repeat treatments. Filler results are immediate, making this attractive for short-term improvement. Microneedling creates controlled microinjuries, stimulating collagen production and remodeling scarred tissue. Multiple sessions, typically 4 to 6, provide progressive scar improvement. Microneedling works for all scar types and is relatively affordable compared to laser treatments. Chemical peels can improve shallow scars through repeated treatments. TCA, trichloroacetic acid, peels at medium depth can improve scar appearance, though results are less dramatic than laser or microneedling. Treatment selection depends on scar type, depth, and individual factors. Dermatologists typically recommend combination approaches, perhaps subcision combined with microneedling, or laser resurfacing combined with fillers. Severe, extensive scarring might warrant multiple treatment types performed sequentially. Realistic expectations are essential. Most scars can be significantly improved but rarely completely eliminated. Even after multiple treatments, mild scarring typically remains. However, significant improvement is usually achievable with appropriate treatments. Guide 13: Face Masks and Professional Facials for Acne Management. Face masks and professional facials supplement your daily skincare routine, providing concentrated treatments and professional expertise. Understanding various mask types and facial treatments helps you select appropriate options for your skin concerns. Clay masks absorb excess oil and impurities, making them ideal for oily, acne-prone skin. Green clay and kaolin clay are particularly effective. These masks draw out sebum, bacteria, and impurities from pores. Use clay masks 1 to 2 times weekly for 10 to 15 minutes on clean skin. Apply evenly, avoiding the eye area. As the mask dries, you'll feel slight tightening as oil is extracted. Rinse with lukewarm water and follow with moisturizer, as clay masks can be drying. Sheet masks infused with acne-fighting ingredients like salicylic acid, tea tree oil, or niacinamide provide targeted treatment and hydration simultaneously. Apply sheet masks to clean skin for 15 to 20 minutes, then remove and pat remaining serum into skin. Use 2 to 3 times weekly. Sheet masks are convenient, mess-free, and come in numerous formulations targeting specific concerns. Hydrating masks with hyaluronic acid, glycerin, or ceramides balance skin and prevent overdrying from acne treatments. These masks are essential if your acne treatment regimen is causing excessive dryness. Use hydrating masks 1 to 2 times weekly, particularly on days when you're using strong actives like retinoids or chemical exfoliants. Mud masks similar to clay masks draw impurities from pores while providing mineral content. Some formulations include additional active ingredients. Use similarly to clay masks, 1 to 2 times weekly for 10 to 15 minutes. Charcoal masks draw impurities naturally drying. Use sparingly, perhaps monthly, if you have very oily skin. Avoid if your skin is dry or sensitive. Overnight masks are left on overnight and act as intensive treatments. Some are essentially very rich moisturizers, while others contain actives like retinol or acids. These work well for providing intensive treatment without time constraints. Apply as your final nighttime step and sleep with the mask on. Spot masks apply highly concentrated treatments to specific areas rather than your entire face. These are useful when some areas are more problematic than others. Apply to clean skin and leave on as directed. Important mask principles. Never use multiple mask types on the same day. Choose one mask per skincare session. Always follow mask application with appropriate moisturizer, as masks can be drying. Start with masks once weekly, increasing frequency only as your skin demonstrates tolerance. Don't leave masks on longer than recommended. Longer application doesn't mean better results and risks overdrying. Masks are supplements to your core routine, not replacements for daily cleansing and treatment. Professional facials go beyond at-home masks, utilizing professional strength products, specialized equipment, and esthetician expertise. A typical acne-focused facial includes cleansing, exfoliation, extraction, treatment mask, and moisturizer application. The extraction component, professional removal of comedones, provides benefits impossible to achieve safely at home. Hydrofacial uses suction technology to extract impurities from pores without harsh manual extraction. A spiral tip applies suction while simultaneously infusing treatment serums. Hydrofacials provide immediate visible improvement, particularly for comedones. Most people see results after a single treatment, with cumulative benefits after 4 to 6 treatments performed monthly. Chemical peel facials use professional strength acids, glycolic acid, salicylic acid, or lactic acid, to exfoliate multiple skin layers. Superficial peels cause mild redness and slight flaking but require no downtime. Medium peels cause more significant exfoliation and require several days of recovery. Chemical peels improve acne, texture, and hyperpigmentation significantly. Monthly superficial peels or quarterly medium peels provide excellent results. Blue light therapy facials use specific light wavelengths to kill acne-causing bacteria. Blue light, around 415 nanometers wavelength, is particularly effective against Cutibacterium acnes. Treatments typically last 15 to 20 minutes. Most treatment plans include 6 to 8 sessions, sometimes combined with red light therapy for inflammation reduction. Blue light therapy is particularly valuable for those seeking non-chemical treatment or for bacterial acne resistant to other treatments. Microdermabrasion facials use fine crystals or a diamond tip to physically exfoliate skin. This removes dead skin cells, unclogs pores, and stimulates collagen production. Results are immediate visible skin smoothing. Regular microdermabrasion, monthly, maintains clear skin and improves texture. Oxygen facials infuse pressurized oxygen with serums deep into skin. While marketed aggressively, evidence for exceptional benefits is limited. However, many people report improved hydration and glow after oxygen facials. Dermaplane facials use a sterile blade to remove fine facial hair and dead skin cells. This provides exfoliation and hair removal simultaneously. Results are immediate, smooth, bright skin. However, However, dermaplaning isn't appropriate for acne-prone or actively inflamed skin, as the blade can irritate lesions. Laser facials use laser technology for exfoliation, collagen stimulation, and targeted treatment of specific concerns. Fractional laser facials are gentler than full laser resurfacing and provide results with minimal downtime. Professional facials are most effective when combined with consistent home skincare. Monthly professional treatments combined with daily. Many people use ketoconazole shampoo on body areas, lathering and leaving it on for 5 to 10 minutes before rinsing. Ketoconazole is gentle and suitable for frequent use. Zinc pyrithione is another topical antifungal commonly found in anti-dandruff shampoos. At 1 to 2% concentration, applied daily, it reduces malassezia and can improve fungal acne. Like ketoconazole, it's gentle and suitable for long-term use. Selenium sulfide is a strong topical antifungal traditionally used for fungal skin conditions. At 2.5% concentration, available by prescription, applied daily, selenium sulfide effectively treats fungal acne. However, some people find it irritating or have sensitivity, limiting its use in some cases. For extensive fungal acne or fungal acne resistant to topical antifungals, oral antifungals may be necessary. Fluconazole is a systemic antifungal taken orally. Typical dosing for fungal acne is 50 to 100 mg daily for 2 to 4 weeks, or alternatively, 200 mg weekly for several weeks. Oral fluconazole effectively treats extensive fungal acne and reaches areas topical antifungals cannot. However, oral antifungals can have side effects and require more medical supervision than topicals. Itraconazole is another systemic antifungal option, sometimes used as an alternative to fluconazole. Dosing and duration vary based on specific protocols and severity. Additional strategies for fungal acne management include addressing contributing factors. Wear breathable, moisture-wicking clothing. Shower promptly after sweating. Keep skin clean and dry. Use gentle, minimal skin care. Avoid heavy oils and occlusive moisturizers. Live and dry environments when possible or use a dehumidifier. These environmental modifications reduce conditions favoring yeast overgrowth. Niacinamide may provide supplementary benefit for fungal acne, as it has mild antifungal properties and reduces sebum production. Including a niacinamide product in your routine might provide additional benefit alongside topical antifungals. The challenge with fungal acne is that it can recur if contributing factors aren't addressed. If you treat fungal acne successfully but then resume wearing tight synthetic clothing in a humid environment, fungal acne may recur. Long-term management might involve occasional use of topical antifungals, weekly or monthly, to prevent recurrence. If you've been treating acne without improvement for several weeks or months, ask your dermatologist about fungal acne. A simple KOH preparation takes minutes and can confirm or rule out malassezia. Don't waste time on ineffective antibacterial treatments if you have fungal acne. Appropriate antifungal treatment provides rapid improvement. Guide 25, Acne in Different Life Stages, Adolescent, Adult, and Menopausal Acne. Acne presents differently and requires different approaches depending on life stage. Understanding age-specific acne characteristics and treatment approaches ensures appropriate management across different ages. Adolescent acne, occurring during puberty, is the most common form. Hormonal changes during puberty, particularly increased androgens, trigger increased sebum production, making adolescent acne typically more oily and comedone-prone. Adolescent acne often affects the T-zone, forehead, nose, chin, particularly heavily. Peer influence, stress about appearance, and psychological impact are often significant. Most adolescents can manage acne with topical treatments alone, though moderate to severe cases may require oral antibiotics or hormonal treatments, particularly girls. Treatment approach for adolescent acne emphasizes prevention and establishing good habits. Starting with gentle cleansing, topical treatments, and sun protection during teenage years establishes habits that persist into adulthood. Most adolescent acne improves or resolves as hormonal stability is achieved in late teens or early 20s, though some individuals continue experiencing acne into adulthood. Adult acne, occurring in adults beyond teenage years, has different characteristics. Adult acne is often more localized, jawline, chin, lower face, and frequently hormonal in nature, particularly in women. Adult acne is often more inflammatory than comedonal compared to adolescent acne. Stress, hormonal cycles, skincare product irritation, and lifestyle factors play larger roles in adult acne than in adolescent acne. Adult acne is sometimes attributed to skincare products or cosmetics, acne cosmetica. Adult women with acne often benefit from hormonal evaluation and hormonal treatments. Oral contraceptives or spironolactone can provide significant improvement. Additionally, adult women should evaluate whether acne patterns correlate with their menstrual cycle, as this suggests hormonal involvement. Adult male acne is less common than in adolescence but does occur. When it persists into adulthood, it's often quite severe and may warrant aggressive treatment including isotretinoin consideration if not responsive to standard treatments. Occupational factors sometimes contribute to adult acne. Individuals with occupations exposing them to oils, chemicals, or heat, mechanics, cooks, healthcare workers, sometimes experience acne from occupational exposure. In these cases, addressing occupational factors, protective equipment, skin cleansing protocols, helps alongside medical treatment. Menopausal acne occurs in perimenopausal and menopausal women due to hormonal fluctuations. As estrogen levels decline and the ratio of androgens to estrogen increases, acne can develop or worsen. Menopausal acne often presents as deep, cystic lesions on the lower face and chin. Hormone replacement therapy, HRT, during menopause can help manage menopausal acne, though it's a complex decision requiring discussion with your healthcare provider about overall health implications of HRT. If HRT isn't pursued, topical treatments and oral spironolactone are options for menopausal acne. Many menopausal women find that aggressive topical treatment with retinoids and benzoyl peroxide adequately controls acne. Stress management and lifestyle optimization become increasingly important during menopause. Pregnancy acne occurs in some pregnant women due to hormonal changes. Treatment options are limited during pregnancy because many acne medications are contraindicated. Isotretinoin is absolutely contraindicated due to severe teratogenic effects. Retinoids are generally avoided. Oral antibiotics like doxycycline are contraindicated. Spironolactone is contraindicated due to potential effects on male fetus development. Safe treatment options during pregnancy include topical benzoyl peroxide, topical azelaic acid, topical salicylic acid, though large-scale systemic absorption is theoretically possible with large-area application, and it's best used sparingly, and possibly topical clindamycin. Most women manage pregnancy acne with these limited options, prioritizing safety. Some pregnant women actually experience improvement in acne due to pregnancy hormonal changes, while others experience worsening. Postpartum acne sometimes occurs as hormones shift again after delivery. This usually resolves within several months, though if breastfeeding is occurring, some hormonal factors may persist. Standard acne treatments are generally safe while breastfeeding, though some medications require careful consideration. Discuss specific medications with your healthcare provider if treating acne while breastfeeding. Age-related changes in acne treatment tolerance are important. Adolescent skin is generally very resilient and tolerates aggressive treatment well. Aging skin becomes more sensitive and drier, requiring gentler treatments and more aggressive moisturizing even if using the same medications. An adolescent might tolerate 2% salicylic acid daily with minimal dryness, while a 45-year-old woman with the same treatment might experience excessive dryness and irritation, necessitating reduced frequency or concentration. Transitional acne between life stages sometimes occurs. A teenager transitioning to adulthood might experience changing acne patterns. An adult woman starting hormonal contraceptive might initially experience worsening acne before.
Welcome, and take this moment to breathe deeply and settle into peace. Tonight we're going to explore the double cleansing method, a gentle yet thorough approach to evening skincare that originated in Korea and Japan. Double cleansing isn't about being excessive or washing your face until it's stripped bare. It's about cleansing intelligently, removing different types of buildup with the right tools for each task. It's about being thorough without being harsh. Let's begin by understanding why double cleansing exists and what problem it solves. Throughout your day, your skin accumulates various types of buildup. There's oil-based buildup, sunscreen, makeup, sebum your skin naturally produces, and environmental pollutants that mix with these oils. Then there's water-based buildup, sweat, dirt, and water-soluble debris. These different types of buildup require different cleaning approaches. You've probably heard the phrase, like dissolves like. Oil dissolves oil, water dissolves water. Soluble substances. This is the principle behind double cleansing. A single water-based cleanser, no matter how good, struggles to remove oil-based buildup thoroughly. It might remove some, but not all. Remnants of sunscreen, makeup, and oil can remain on your skin, potentially clogging pores, preventing your nighttime products from absorbing and interfering with your skin's overnight repair process. This is where double cleansing comes in. The first cleanse uses an oil-based cleanser to dissolve and remove oil-based buildup. The second cleanse uses a water-based cleanser to remove any remaining water-soluble residue and ensure your skin is truly clean. Let's explore the first cleanse, oil-based cleansing. Oil-based cleansers come in several forms: cleansing oils, cleansing balms, and oil-based micellar waters. All work on the same principle, using oil to dissolve the oil-based substances on your skin. When you apply an oil-based cleanser to dry skin, it mixes with the oils, sunscreen, and makeup on your face. Massage it gently, and you can feel these substances loosening and dissolving. The oil breaks down even waterproof mascara, long-wearing foundation, and mineral sunscreen with ease, all without harsh rubbing or scrubbing. Here's the beautiful part. Most modern oil cleansers are emulsifying. This means when you add water, they transform from oil into a milky liquid that rinses away cleanly, taking all that dissolved makeup and sunscreen with them. No greasy residue remains. This emulsifying property makes oil cleansing completely different from simply washing your face with cooking oil, which would leave a greasy film. Emulsifying oil cleansers rinse clean, leaving your skin soft but not oily. The first cleanse is gentle yet incredibly effective. You're not scrubbing or tugging at your skin to remove makeup. You're dissolving it. This is especially valuable for your eye area, where the skin is delicate and should never be rubbed aggressively. After rinsing your first cleanse, your skin should feel clean, but perhaps still slightly filmy. That's okay. That's what the second cleanse addresses. Now let's explore the second cleanse. Water-based cleansing. Your second cleanser is your regular facial cleanser, a gel, foam, cream, or milk cleanser that's water-based. This cleanser removes any residue from the first cleanse, along with sweat, dirt, and any water-soluble debris your oil cleanser didn't address. The second cleanse is also where you can target specific skin needs. If you have acne-prone skin, your second cleanser might contain salicylic acid. If you have dry skin, you might use a creamy, hydrating cleanser. This cleanse is personalized to your skin type and concerns. After this second cleanse, your skin should feel clean, comfortable, and fresh. Not tight, not stripped, just genuinely clean. Your face is now a blank canvas, ready for your treatment products and moisturizers. Now let's discuss how to double cleanse properly. Step 1. Apply your oil cleanser to dry skin. This is important. Don't wet your face first. Your skin should be completely dry. Dispense the oil cleanser into your hands and apply it all over your face, including your eye area if you're wearing makeup there. Massage gently for 60-90 seconds. This isn't a quick swipe. Take your time. Use circular motions. Feel the makeup and sunscreen melting away. This massage time is crucial for thorough removal. Focus on areas where makeup and sunscreen tend to accumulate. Around your nose, your hairline, your jawline. If you're wearing eye makeup, be especially gentle but thorough around your eyes. Step 2. Add water to emulsify. Wet your hands and add water to your face, continuing the massage. Watch as the oil transforms into a milky texture. This emulsification is the oil cleanser, binding with water so it can rinse away. Rinse thoroughly with lukewarm water. Make sure all the oil cleanser is removed. Check your hairline, jawline, and neck. Step 3. Apply your water-based cleanser to wet skin. This time, your face should be wet. Massage gently for 30-60 seconds, creating a light lather if your cleanser foams. Rinse thoroughly with lukewarm water. Make sure no cleanser residue remains. Step 4. Pat dry gently with a clean towel. Don't rub, pat. Your skin should feel clean, soft, and comfortable. The entire double cleanse process takes about 3 to 5 minutes. Yes, it's longer than a single cleanse, but the thoroughness is worth it. Who needs double cleansing? Anyone who wears sunscreen, makeup, or both. Even if you don't wear makeup, if you wear sunscreen daily, which you should, double cleansing ensures complete removal. Even people who wear just sunscreen benefit from double cleansing. Many sunscreens, especially waterproof or mineral formulas, don't remove completely with a single water-based cleanse. Remnants can clog pores and prevent your evening skincare from absorbing properly. If you wear heavy makeup, waterproof mascara, or long-wearing foundation, double cleansing is especially important. These products are designed to stay put. A single cleanse often isn't enough. Who might not need double cleansing? If you truly wear zero sunscreen and zero makeup, you probably don't need to double cleanse. A thorough single cleanse is sufficient. However, even people who don't wear products might appreciate the gentle, spa-like quality of an oil cleanse once or twice a week. Let's address some common concerns about double cleansing. Won't oil cleansers make my skin oily? No. Remember, like oil dissolves oil. Oil cleansing can actually help balance oil production. For oily skin types, oil cleansing might feel counterintuitive, but many people with oily skin find it helps regulate their natural oil production over time. Isn't double cleansing too much for my skin? Not if done gently with appropriate products. You're not scrubbing twice. You're using two different types of cleansers to address two different types of buildup. Done properly, double cleansing is thorough without being harsh. Do I need to double cleanse every day? Only at night and only on days when you've worn sunscreen or makeup. In the morning, a single gentle cleanse is sufficient. You haven't accumulated oil-based products overnight. Can I use makeup wipes instead of the first cleanse? Makeup wipes are better than sleeping in makeup, but they're not ideal. They require rubbing and tugging, they don't remove everything, and they often leave residue. An oil cleanse is gentler and more effective. What if I have acne-prone skin? Double cleansing can actually help acne-prone skin by ensuring pores are thoroughly clear of pore clogging residue. Choose non-comedogenic oil cleansers and a salicylic acid second cleanser for best results. Choosing the right oil cleanser, look for products specifically labeled cleansing oil or cleansing balm. These are formulated to emulsify and rinse clean. Avoid straight oils like coconut oil or olive oil. These don't emulsify and can leave residue. For oily or acne-prone skin, look for lightweight oils like jojoba or grapeseed. For dry skin, richer formulas with olive or sunflower oil work beautifully. For sensitive skin, choose fragrance-free formulas with soothing ingredients. Cleansing balms are solid at room temperature, but melt into oil upon contact with your skin. They're lovely to use and travel well. Cleansing oils are liquid from the start. Both work equally well. It's personal preference. Choosing the right second cleanser. This is your regular face wash, chosen for your skin type. Gel cleansers for oily skin, cream cleansers for dry skin, gentle, fragrance-free options for sensitive skin. Use what works for your skin. The beauty of double cleansing is that it becomes a ritual, a way to transition from day to night. As you massage the oil cleanser into your skin, you're not welcome to this peaceful moment. Settle in and let's begin with a breath. Breathe in slowly through your nose. Hold for a moment and exhale completely through your mouth. Feel your body relax with that exhale. Today we're going to explore something remarkable, how something as simple as breathing can profoundly affect your skin's health and appearance. Breathing is something you do automatically, thousands of times each day, without thought. But when you bring conscious awareness to your breath, when you use it intentionally, it becomes a powerful tool for managing stress, supporting circulation, and promoting skin health. Let's start by understanding the connection between breath, your nervous system, and your skin. Your autonomic nervous system has two main branches: the sympathetic nervous system, which activates your stress response, and the parasympathetic nervous system, which promotes rest, relaxation, and healing. Your skin's health is significantly influenced by which system is dominant. When your sympathetic nervous system is activated, when you're stressed, your body produces cortisol and adrenaline. Blood flow is redirected away from your skin toward your muscles and vital organs. Your skin produces more oil, inflammation increases, healing slows. Your skin barrier weakens. We discussed these effects in our previous conversation about stress. When your parasympathetic nervous system is activated, when you're relaxed, opposite effects occur. Cortisol levels drop. Blood flow to your skin increases, bringing oxygen and nutrients while carrying away waste products. Inflammation decreases. Healing accelerates. Your skin barrier strengthens. Cell regeneration improves. Here's what's remarkable. Your breath is a bridge between your conscious and unconscious systems. While you can't directly tell your heart rate to slow or your blood pressure to drop, you can control your breath. And when you breathe slowly and deeply, your breath sends a signal to your nervous system. We're safe, we can relax. This activates your parasympathetic response. This isn't mystical or metaphorical, it's physiology. Slow, deep breathing stimulates the vagus nerve, the main nerve of your parasympathetic nervous system. This activation cascades throughout your body, including your skin. Let's explore specific breathing techniques that support relaxation and skin health. Diaphragmatic breathing, also called belly breathing, is foundational. Most people breathe shallowly into their chest, especially when stressed. This rapid, shallow breathing reinforces your stress response. Diaphragmatic breathing does the opposite. Place one hand on your chest and one on your belly. Breathe in slowly through your nose, allowing your belly to expand like a balloon. Your chest should move minimally. The movement should be in your abdomen. This is your diaphragm descending, allowing your lungs to fill fully. Then exhale slowly through your mouth, feeling your belly deflate. Practice this for a few minutes daily. Over time, this deeper breathing pattern can become more automatic. The 4-7-8 breathing technique is particularly effective for relaxation. Breathe in through your nose for a count of 4. Hold your breath for a count of 7. Exhale completely through your mouth for a count of 8, making a whooshing sound. Repeat this cycle 3 to 4 times. This pattern is deeply calming and can help quiet a racing mind or reduce anxiety. Box breathing, used by athletes and military personnel for stress management, is another powerful technique. Visualize a box as you breathe. Inhale for 4 counts. Hold for 4 counts. Exhale for 4 counts. Hold empty for 4 counts. Repeat several times. This creates a rhythm that calms your nervous system and helps you feel centered and grounded. Alternate nostril breathing from yoga traditions balances your nervous system. Use your thumb to close your right nostril and breathe in slowly through your left nostril. Close your left nostril with your ring finger. Release your thumb and exhale through your right nostril. Inhale through your right nostril. Close it and exhale through your left. This is 1 round. Continue for several rounds. Many people find this technique particularly soothing and centering. When should you practice these breathing techniques? Any time, but especially during stressful moments before sleep, upon waking, or during your skincare routine. Your morning and evening skincare rituals are perfect opportunities to incorporate conscious breathing. As you cleanse your face, breathe deeply. As you apply your products, maintain slow, relaxed breathing. This transforms your skincare routine from a task into a meditative practice that benefits both your mind and your skin. Now let's discuss the direct effects of proper breathing on your skin. Oxygen is essential for every cell in your body, including your skin cells. When you breathe deeply and fully, you increase the oxygen content of your blood. This oxygen-rich blood circulates to your skin, supporting cellular energy production, repair processes, and overall vitality. Skin that receives adequate oxygen has a healthy, vibrant appearance, that natural glow that can't be replicated by products alone. Improved circulation from relaxation and deep breathing means your skin receives more nutrients. Everything your skin needs to be healthy, vitamins, minerals, amino acids, antioxidants, reaches your skin cells via your bloodstream. Better circulation means better delivery of these essential nutrients. Waste removal improves as well. Your skin cells, like all cells, produce metabolic waste products. These need to be carried away for your skin to function optimally. Good circulation, supported by proper oxygenation and relaxation, enhances this detoxification process. Collagen production benefits from reduced stress and improved oxygenation. Collagen synthesis requires oxygen and numerous nutrients. When your cells are well oxygenated and your stress hormones are low, your skin can produce collagen more effectively. Your skin's barrier function strengthens when you're relaxed. Remember, chronic stress weakens your skin's protective barrier. Relaxation does the opposite, allowing your skin to maintain its integrity and protect itself from environmental stressors, irritants, and moisture loss. Inflammation reduces. This is perhaps one of the most significant benefits. Chronic low-level inflammation, often driven by stress, contributes to aging, acne, rosacea, and numerous other skin concerns. Practices that activate your relaxation response, including conscious breathing, reduce this inflammation. Let's talk about facial exercises and facial massage, both of which can be combined with breathing for enhanced benefits. Facial massage, when performed gently, can improve lymphatic drainage, reduce puffiness, and promote relaxation. As you apply your skincare products, take an extra 2 minutes to massage your face. Use gentle upward strokes. Work from the center of your face outward. Use light pressure. You're not pushing hard, just encouraging movement of fluids and gentle stimulation of your skin. As you massage, breathe deeply and slowly. With each exhale, release any tension you're holding in your face. Your face holds stress, just like your shoulders or back. Your jaw might be clenched. Your forehead might be furrowed. As you breathe and massage, invite these areas to soften and release. Gua sha and facial rolling tools can enhance facial massage. These tools, used gently with appropriate pressure, can feel wonderful and support lymphatic drainage. However, they're not necessary. Your fingers work beautifully too. What matters most is the gentle attention you're giving to your face, combined with relaxed breathing. Let's address progressive relaxation, a technique that can reduce overall tension and benefit your skin. Starting with your toes, tense each muscle group for a few seconds, then release completely. Move up through your body: feet, calves, thighs, abdomen, chest, hands, arms, shoulders, neck, face. Notice the difference between tension and relaxation. This practice helps you become aware of held tension and releases it, reducing the physical manifestations of stress on your skin. Mindfulness meditation, which often focuses on breath, provides significant skin benefits. When you practice observing your thoughts without judgment, when you return your attention to your breath again and again, you're training your nervous system to be less reactive to stress. Over time, regular meditation practice can reduce baseline stress and anxiety levels, which directly benefits your skin. You don't need hours for these practices. Even 5 minutes of conscious breathing daily makes a difference. The key is consistency. Daily practice, even if brief, creates cumulative benefits that occasional longer sessions cannot match. Make relaxation and breathing part of your overall skin health strategy. You invest time in choosing products, applying them carefully, protecting your skin from the sun. Invest a few minutes daily in breathing and relaxation too. This internal work supports and enhances all your external skincare efforts. Notice how your skin looks and feels when you're relaxed versus when you're stressed. Pay attention to this connection in your own body. You might notice that after a restful vacation, your skin looks radiant, or that during stressful work periods, your skin becomes problematic. These aren't coincidences. They're your body showing you the mind-skin connection. For those with specific skin conditions triggered or worsened by stress, breathing and relaxation practices can be particularly valuable. If you have stress-triggered acne, eczema flares, or rosacea outbreaks, incorporating daily relaxation practices might reduce the frequency and severity of these flares. One important note: learning to relax is a skill, especially if you've been chronically stressed for a long time. Your nervous system needs time to recalibrate. The benefits for your skin and your overall well-being accumulate over time, just like skincare products do. Don't expect instant perfection. Some days your mind will be too busy to quiet. Some days you'll forget to practice. This is normal and okay. What matters is gently returning to the practice, again and again, with patience and without judgment. As we come to the close of our time together, embrace this beautiful truth. You carry powerful skin treatments with you always, in your breath and your capacity for relaxation. No product can replace the benefits of reduced stress, adequate oxygen, improved circulation, and your body's natural healing processes functioning optimally. Your skin is not just affected by what you put on it. It's profoundly affected by how you live, how you breathe, how you manage stress, and how you allow yourself to rest and relax. Attending to these internal factors complements your external skincare practices and often produces results that products alone cannot achieve. Take a deep, nourishing breath right now. Feel it filling your body with oxygen, activating your relaxation response, supporting your skin's health from within. This breath and every conscious breath you take is a gift to your skin and your entire being. May you breathe deeply and often. May you find moments of true relaxation in your days. May your skin reflect the peace and care you cultivate within. Thank you for this time together. Breathe well and be at peace. Welcome to this peaceful moment of reflection and learning. Take a slow, deep breath in, filling yourself with calm awareness. Release it gently, allowing any tension to dissolve. Today we're going to talk about something that affects so many people, yet often goes unrecognized. Over-cleansing, and how to stop this cycle that may be undermining your skin's health. In our culture, cleanliness is deeply valued. We're taught that clean is good, that more cleaning is better, that squeaky clean skin is the goal. But when it comes to your face, this mentality can actually damage your skin. Over-cleansing is one of the most common skincare mistakes, and it creates a cascade of problems that people then try to fix with more products, more treatments, more intervention, never realizing that the cleansing itself is the root issue. Let's begin by understanding what over-cleansing means and how it damages your skin. Over-cleansing happens when you cleanse too frequently, too aggressively with products that are too harsh, or in ways that strip away your skin's natural protective elements. Your skin has a delicate balance of natural oils, beneficial bacteria, and a pH level that supports its barrier function. When you over-cleanse, you disrupt all of these, leaving your skin compromised and struggling. Think of your skin barrier like a brick wall with mortar holding it together. The bricks are your skin cells, and the mortar is made of lipids, natural oils, and fats. When you cleanse appropriately, you remove dirt and excess surface oil while leaving the structural mortar intact. When you over-cleanse, you start dissolving the mortar itself, weakening the entire wall. What does over-cleansing look like in practice? It might be cleansing your face multiple times per day. It might be using harsh, stripping cleansers, especially those with sulfates that create lots of foam. It might be using very hot water. It might be scrubbing your face aggressively or using rough washcloths, brushes, or other abrasive tools. It might be using cleansers with high pH that disrupts your skin's natural acidity. Often it's a combination of these factors. The irony of over-cleansing is that it often creates the very problems people are trying to prevent. Your skin feels oily, so you cleanse it frequently with harsh products to remove the oil. But this stripping triggers your skin to produce even more oil to compensate for what you're removing. You end up in a vicious cycle. Over-cleanse, excess oil production, over-cleanse more, even more oil production. The solution isn't more cleansing, it's better, gentler cleansing. Let's explore the signs that you might be over-cleansing. Your skin feels tight, especially immediately after cleansing. This tightness is not a sign of cleanliness. It's a sign that you've stripped too much from your skin. Healthy cleansing leaves your skin feeling clean but comfortable, never tight or pulled. Your skin has that squeaky clean feeling after washing. Again, this isn't the goal. Squeaky clean means you've removed so much natural oil that your skin literally has high friction. This is over-cleansing. Your skin becomes shiny or oily within an hour or two of cleansing, even after you've applied moisturizer. This rapid oil production is often your skin overcompensating for being stripped. You experience increased sensitivity, redness, or irritation. When you over-cleanse, you compromise your barrier, making your skin more reactive to everything: products, environment, even water. You have persistent dryness, flaking, or rough texture despite using moisturizer. No amount of moisturizer can fully compensate for a barrier that's being damaged daily by over-cleansing. You're dealing with more breakouts despite cleaning your face diligently. A compromised barrier from over-cleansing actually makes acne worse by weakening your skin's defense mechanisms and potentially spreading bacteria across your face. Your skin has become more problematic since you started cleansing more or using stronger cleansers. If your skin was better before you intensified your cleansing routine, that's a clear signal. Now let's talk about why people over-cleanse, because understanding your motivations helps you change the behavior. Many people over-cleanse because they've been taught that it's necessary. Magazine articles, product marketing, and cultural messages all reinforce the idea that thorough, frequent cleansing is essential for clear skin. This isn't true, but the message is pervasive. Some people over-cleanse in an attempt to control oily skin or acne. If you're dealing with these concerns, it's natural to think that more cleaning will help. Unfortunately, as we've discussed, it usually makes things worse. Others over-cleanse because it feels good in the moment. That tight, squeaky clean sensation can feel satisfying, like you've really accomplished something. But this temporary satisfaction causes lasting damage. Some people over-cleanse out of anxiety or a need for control. If your life feels chaotic, controlling your skincare routine, making sure your face is absolutely clean, can feel grounding. This is understandable, but there are better ways to create that sense of control without damaging your skin. Now let's explore how to stop over-cleansing and restore your skin's health. The first step is to reduce your cleansing frequency. For most people, cleansing once per day is sufficient. In the evening, to remove the day's accumulation of oil, sunscreen, makeup, and environmental pollutants. In the morning, many skin types can simply rinse with lukewarm water rather than using a cleanser. This is especially true for dry, sensitive, or mature skin. If you currently cleanse twice daily with cleanser, try switching to just a water rinse in the morning. Your skin hasn't gotten dirty overnight. There's no makeup, no sunscreen, no pollution to remove. The light layer of natural oil your skin produced overnight is actually protective and beneficial. Let it be. Only cleanse with cleanser when your skin actually needs it, after wearing makeup, sunscreen, or heavy moisturizers, or after sweating significantly. Other times, water is often enough. The second step is to choose a gentler cleanser. Put away any cleansers containing sodium lauryl sulfate, which is particularly stripping. Look for gentle pH balance cleansers. Cream cleansers, milk cleansers, or gentle gel cleansers without harsh surfactants. Your cleanser should have a pH around 5.5, matching your skin's natural pH. The cleanser should not produce a lot of foam. While foam isn't inherently bad, cleansers that create abundant, luxurious lather usually contain stronger surfactants that are more likely to strip your skin. A good gentle cleanser might produce minimal or no foam, and that's perfectly fine. Read the ingredient list. Avoid cleansers with high amounts of alcohol, fragrance at the top of the list, or anything marketed as deep cleaning, clarifying, or purifying. These often indicate harsher formulas. Look for cleansers described as gentle, hydrating, or cream-based. The third step is to adjust your cleansing technique. Use lukewarm water only, never hot. Hot water feels soothing but strips your natural oils and can damage capillaries over time. Similarly, avoid very cold water, which doesn't allow cleansers to work effectively. Apply your cleanser to damp skin and massage gently with your fingertips for about 60 seconds. This is enough time for the cleanser to work without being excessive. Use light, circular motions. Don't scrub, press hard, or pull at your skin. Pretend you're cleansing a baby's face. That's the level of gentleness appropriate for your own face. Rinse thoroughly and completely. Incomplete rinsing can leave residue that irritates skin, but excessive rinsing is also unnecessary. Splash your face repeatedly with lukewarm water until all cleanser is gone. Usually 10 to 15 splashes, then stop. Pat your face dry with a soft, clean towel. Don't rub. Rubbing creates friction and can irritate skin, especially when damp and vulnerable. The fourth step is to eliminate aggressive cleansing tools or use them much more carefully. Put away harsh facial brushes, rough washcloths, and abrasive scrubs. Your hands are the best tools for cleansing. They allow precise pressure control and don't harbor bacteria like reusable tools can. If you enjoy using tools, choose soft silicone cleansing pads used gently, or very soft washcloths used with minimal pressure. Clean any reusable tools thoroughly after each use and replace them regularly. Completely stop using physical exfoliating scrubs with rough particles. These are almost always too harsh and create micro tears in your skin. If you want exfoliation, gentle chemical exfoliants used sparingly are far safer and more effective. Now let's discuss the transition period and what to expect when you stop over-cleansing. When you first reduce cleansing frequency or switch to gentler cleansing, your skin might go through an adjustment period. If you've been over-cleansing, your oil glands have been in overdrive. When you stop stripping your skin, it takes time for oil production to normalize, usually 1 to 3 weeks. During this transition, your skin might feel slightly more oily than usual. This is temporary. Resist the urge to go back to harsh cleansing. Stay the course with gentle cleansing. Use a lightweight moisturizer and be patient. Your skin will rebalance. You might also notice some initial purging or congestion as your skin adjusts and its natural processes normalize. Again, this is temporary and should resolve within a few weeks. If it persists beyond a month, you may need to adjust something else in your routine. But the gentler cleansing itself is still correct. As your skin rebalances, you'll start noticing improvements, less tightness and discomfort, decreased oil production as your skin no longer overcompensates, improved texture and reduced sensitivity, better response to your other skincare products because your barrier is intact, fewer breakouts as your skin can function normally, and an overall healthier appearance. Let's address specific situations and skin types. For oily or acne-prone skin, gentle cleansing is still the answer. Use a gentle gel or foam cleanser once daily in the evening. You can use a BHA treatment separately after cleansing if needed for acne, but the cleansing itself should be gentle. Morning water rinse is often sufficient. If you must cleanse in the morning, use the same gentle cleanser very briefly. For dry or sensitive skin, cleansing once daily is usually enough, and you might even reduce to every other day if your skin tolerates it. Use a cream cleanser or cleansing milk. Consider cleansing oils or balms, which cleanse while nourishing. Morning water rinse is definitely sufficient. For combination skin, one evening cleanse with a balanced, gentle cleanser usually works well. If your T-zone feels it needs morning cleansing, you can cleanse just that area with cleanser while rinsing the rest with water, but this is optional. If you wear heavy makeup or waterproof sunscreen, you might benefit from double cleansing in the evening. First with an oil-based cleanser or micellar water to dissolve makeup and sunscreen, then with your gentle, regular cleanser. But this is still just once per day in the evening, and both cleansers should be gentle. Let's talk about exercise and sweat. After working out, you want to cleanse away sweat, but you still want to be gentle. If you exercise in the morning, that can be your one cleansing of the day. If you exercise midday, cleanse gently after, then just rinse with water that evening. Don't cleanse 3 times per day, even on workout days. Adjust the timing instead. Creating new cleansing habits takes awareness and practice. It might help to set reminders or create new mental associations. When you reach for your cleanser in the morning, pause and ask, does my skin actually need this, or would water be enough? Often, the honest answer is that water is sufficient. When you cleanse, check your water temperature by testing it on your inner wrist first. If it feels hot, it's too hot for your face. Adjust until it feels neutral, barely warm. Time your cleansing. If you're spending more than 60-90 seconds actually cleansing, you're probably overdoing it. 1 minute is enough for the cleanser to work without stripping your skin. As we come toward closing, embrace this important truth. Clean doesn't mean stripped. Healthy cleansing removes what doesn't belong: dirt, excess surface oil, makeup, sunscreen, while preserving what does belong: your skin's protective barrier, beneficial oils, natural pH, and healthy microbiome. Your skin is not inherently dirty or problematic. It's designed to maintain itself with gentle support, not aggressive intervention. When you stop over-cleansing and start cleansing appropriately, you give your skin the chance to return to its natural, healthy balance. Take a deep breath. You now understand over-cleansing and how to stop it. You know that gentle, appropriate cleansing serves your skin far better than harsh, frequent cleansing. May you cleanse with gentleness and intention. May your skin find its natural balance. May you release the need for
dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone, silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, Non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs since prevention is often simpler than treatment. Guide 54. Drug-induced acne and medication side effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible, or combining lithium with aggressive acne treatment, might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrel, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. iodine-containing supplements or medications can trigger acne. High-dose iodine supplementation is associated with acne worsening. This is one reason avoiding excessive iodine supplementation unless specifically indicated is prudent. Phenytoin, anti-seizure medication, and other older anti-seizure drugs can trigger acne or gingival hyperplasia, gum overgrowth. If these medications are necessary, managing side effects is required. When drug-induced acne is suspected, first confirm with your prescribing healthcare provider that the medication is likely the culprit. Assess whether alternative medications without acne side effects exist. If alternatives don't exist, combine the medication with aggressive acne treatment. Don't discontinue necessary medications without medical guidance even if acne worsens. Guide 55. Nutritional deficiencies and acne, zinc, vitamin D, selenium, and beyond. Certain nutritional deficiencies correlate with worse acne. Understanding which deficiencies affect acne allows you to assess your nutritional status and supplement if needed. Zinc deficiency is well established as correlating with worse acne. Zinc supports immune function, wound healing, and inflammation regulation, all relevant to acne. People with zinc deficiency have notably worse acne. Supplementing adequate zinc, 30 mg daily, often improves acne significantly if deficiency exists. However, supplementing when not deficient provides minimal additional benefit. Identifying zinc deficiency involves blood testing. However, zinc blood levels don't always accurately reflect total body zinc stores, making interpretation complex. If you suspect zinc deficiency, discussing blood zinc testing with your healthcare provider is reasonable. Vitamin D deficiency correlates with worse acne and increased inflammation. Vitamin D supports immune function and has anti-inflammatory. Appearance-related anxiety helps reframe negative thoughts about acne, reducing anxiety and depression related to appearance. Specialized dermatology (CBT) combines skin condition understanding with psychological techniques for optimal outcomes. Acceptance and commitment therapy (ACT) helps people accept current skin status while committing to valued activities despite appearance concerns. This approach reduces appearance-focused anxiety while maintaining motivation for treatment. Body image work addressing distorted thinking about appearance supports mental health alongside medical treatment. Body dysmorphic disorder screening is important for those with disproportionate appearance distress. Mindfulness practices reduce appearance-focused anxiety and rumination, supporting mental health during treatment. Dermatology apps using AI analyze skin photos to assess acne severity, identify acne types, and recommend treatments. While some apps show reasonable accuracy for basic assessments, they can't match professional dermatologists for complex cases. These apps serve best as supplements to professional care rather than replacements. Accuracy of AI skin analysis varies. Higher quality apps with larger training datasets and professional validation generally perform better than those lacking proper development. However, all AI assessments have limitations and should be verified by professionals. Personalization algorithms use your skin characteristics, responses to past treatments, and various data points to recommend optimized treatment approaches. As these systems improve and accumulate more treatment outcome data, personalization effectiveness likely improves. Currently, these tools remain supplements to professional judgment rather than replacements. Telemedicine AI-assisted dermatology allows remote consultations where AI supplements the dermatologist's assessment. This can improve access to dermatology for people without nearby specialists. Privacy considerations are important with AI skincare apps. Your skin data is sensitive. Understanding how your data is used and stored matters when choosing AI tools. Guide 44. Peptide therapies and bioidentical hormone treatments. Advanced peptide therapies and bioidentical hormone treatments represent frontier approaches for acne management. Understanding these options helps you discuss them with your healthcare provider. Specific peptides stimulate collagen production and support skin barrier healing. For acne management, peptides primarily support post-acne recovery and scar treatment rather than treating active acne directly. Peptides appear in many premium skincare products. Bioidentical hormone replacement therapy, BHRT, uses hormones chemically identical to your body's natural hormones. For hormonal acne, bioidentical estrogen and progesterone might theoretically provide benefits similar to synthetic hormones in oral contraceptives with theoretically better tolerability. However, evidence for BHRT's superiority for hormonal acne is limited. Additionally, BHRT is more expensive and requires more individualized monitoring than standard hormonal contraceptives. Compounded bioidentical hormone prescriptions allow customization of hormone dosing and ratios. For severe hormonal acne, compounded BHRT might be appropriate, though professional oversight is essential. Guide 45. Nanotechnology in acne treatment. Nanotechnology enables delivery of active ingredients at microscopic scale for potentially enhanced effectiveness. Understanding nanodelivery systems helps you evaluate next-generation acne products. Liposomal formulations encapsulate active ingredients in microscopic lipid spheres, enabling enhanced penetration and stability. Liposomal retinol or liposomal benzoyl peroxide potentially provide enhanced effectiveness with reduced irritation through optimized delivery. Products using liposomal technology are increasingly available commercially. Nanoparticles of active ingredients increase surface area and bioavailability, potentially enhancing effectiveness. Nano-sized acne actives are being researched for enhanced skin penetration and efficacy. Sustained-release nanotechnology enables gradual release of actives over extended periods, potentially maintaining consistent therapeutic levels with less frequent application. Guide 46. Environmental and climate adaptation strategies for acne. Acne management must adapt to different climates and environmental conditions. Understanding climate-specific strategies optimizes treatment across varying conditions. Tropical climates with heat and humidity increase sebum production and bacterial growth. Strategies include more frequent cleansing, lighter formulations, focus on oil control, increased sun protection. Sun worsens heat-related acne, air conditioning when possible, and increased frequency of active acne treatments. Guide 50. Acne success stories, effective patterns, and realistic timelines for clear skin. Examining successful acne treatment patterns and realistic timelines helps set expectations and maintain motivation during treatment journeys. Most people achieve significant acne improvement, 70 to 80% clearing, within 12 weeks with appropriate treatment. Complete clearance often takes 4 to 6 months. Severe acne or scarring might require 6 to 12 months or longer. Successful patterns often involve early professional intervention for moderate severe acne, combination approaches addressing multiple acne factors, consistent routine adherence, lifestyle optimization alongside treatments, patience through initial adaptation phases, and adjustment of treatments based on response. Common obstacles in achieving success include unrealistic expectations for overnight results, giving up after 4 to 6 weeks before full benefits appear, switching treatments too frequently before adequate trial period, neglecting lifestyle factors, inconsistent treatment adherence, and failing to pursue professional help when home treatment insufficient. Inspiring success often involves recognizing that clear skin is achievable through consistent, appropriate treatment. Most acne-prone individuals can achieve clear or nearly clear skin through proper dermatological care combined with appropriate skincare and lifestyle optimization. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties. 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones